Hello, my name is Amir Hashu, uh, and I wanted to speak with you about the user requirements and specifications for the SetPoint VNS therapy device. Uh, so, with all medical devices, we want to ensure that the device is both safe and effective for use. Uh, With that in mind, our first user requirement is that the SetPoint VNS therapy device must be safely implantable. Uh, so to ensure that, our specification with that user requirement will be that the adverse events and severe adverse events, they must be comparable to other VNS-based therapies. Um, so things like deaths, infections, uh, or revision therapies, we want to ensure that they are either comparable or less than what we see with other VNS based therapies that are currently on the market. Uh, and again, with the safety and efficacy in mind, our second priority user requirement is that the SetPoint VNS therapy must have a similar or better efficacy than standard of care treatments for rheumatoid arthritis. Those standard of care treatments would be uh, uh, medication based therapies like Humira or other things like that, or also other VNS based therapies that look that are used to treat rheumatoid arthritis. Um, so how we are going to hone in on that is two key uh, items that are used to track the severity of the arthritis is erythrocyte sedimentation rate, ESR, and C-reactive protein values, CPR values. They must be equal or less than those measured in standard of care treatments. Uh, and the last one that we want to focus on for the purposes of this project uh, would be that the SetPoint VNS therapy device must hold an electric charge to allow a patient to have minimal disruption to daily life, and that the mechanism of charging the device, that user interface, must be easily understood by a patient. The first part of that is that while this isn't a life-sustaining device, you know, it can be disruptive to the patient if this thing doesn't last long enough for them to go about their day-to-day lives. And the second half of this is that the device is actually charged by the patient, the user of it. It's not like a pacemaker where the device has enough battery power to last, the patient's foreseeable life. Uh, in this case, because of the size of the device, it's not large enough to hold a charge for long periods of time. So it requires intermittent charging by the user. Um, so the specifications for this portion is that the SetPoint VNS therapy device's electric charge must last 72 hours without recharging. And then to touch on the second half, the user interface portion, we must have a human factors study that shows that there are no use errors of a patient programming and wearing the SetPoint therapy's charging device, so that they know how to charge it, how to place it on their neck. That's how it's charged. Things like that. The next few, we'll just have them for. Actually, I'll just talk about them briefly. User requirement 4: a SetPoint VNS therapy must have lasting therapeutic benefits. We want to see that at 18 months post-implantation that the ESR and CPR values maintain lower than their baseline. Priority 5, set point VNS therapy device must be able to be securely affixed to the vagus nerve. So, we're implanting this into the body. We want to make sure that it stays in place. And to test it, we're going to look at appropriate animal and benchtop testing models. Priority 6, the set point VNS charging device must fit around the patient's neck. So that's how the charging device works. The patient puts it around their neck, and through the skin, it charges through the body. But if you can't fit the thing around your neck, you can't charge it overnight. So want to make sure that it's adjustable to the typical user of the device. And our last user requirement is that the set point VNS therapies device's electric pulse must not cause damage to the surrounding tissues. So we're going to make sure that the pulse is powerful enough to provide that therapeutic benefit, but not so much that it's going to cause damage either to the vagus nerve itself or anything surrounding it. Yeah, but that's all I have for the user requirements and specifications. Thank you.